by definition, long COVID means it is a state of unhealthy feeling beyond the recovery period of COVID. Some of the symptoms of COVID or new symptoms will persist more than 6 weeks. And we exactly don't know what is the mechanism of this phenomenon. It is thought that some of the viral particles persist in the body beyond the recovery period, and it is also said that there is a persistence of inflammations, and also it is thought that there is an autoimmune mechanism for this phenomenon. But exact phenomenon is not known. But it is a reality that some of the patients, about 10 to 15% of the patients, suffer from long COVID syndrome in the form of an unhealthy status. Now, what to do about this long COVID syndrome? If you feel unhealthy and if you have an intolerable symptoms, then you have to meet your doctor, concerned doctor. What are the symptoms of long COVID symptoms? It has been said that there are about 200 symptoms related to long COVID symptoms. The symptoms can be like headache, cognitive dysfunction in the form of memory problem, calculation problems, or judgment problems. It can be a shortness of breath, cough, chest discomfort, palpitation, or it can be an abdominal discomfort like nausea, altered bowel habits, or it can be like myalgia, arthralgia, and the most common symptom is fatigue and exercise intolerance. So once you meet the doctor will advise you certain investigations. The investigation basically involves the routine investigations like complete blood count, liver function test, kidney function test, and specific investigations related to what kind of symptoms or organs are involved. Suppose if you have breathing difficulty related to cardiac involvement, heart involvement, then doctor will advise you like troponin, ECG, echo, if needed cardiac MRI. If you have breathing difficulty related to your lungs, then the doctor will advise you like X-ray, CT scan, chest, and like that. If there are certain things which we need to have to follow when we suffer from long COVID symptoms. Is one, be confident and reassure yourself it is going to wane over a couple of days. Then second thing is you take adequate fluid and have a good nutritional diet. Then undergo some kind of, if you are having some physical deconditioning, undergo some physical therapy, physiotherapy. Then if you have shortness of breath, we usually recommend some breathing exercise. Breathing exercise like that involves like pursed breathing, deep breathing exercise, diaphragmatic breathing exercise, and there is one device-based breathing exercise that called pyrometric breathing exercise. Actually, supplements are clearly not indicated, but if you take supplement, there is no harm. You can go for like vitamin D, vitamin C, glutathione. You have to follow a graded exercise. What does graded exercise means that usually when you do, if you have a severe symptoms like severe fatigue, usually there is a test called 6 minutes walk test. Like how we will be asked to do a 6-minute walk, and how much and how long you can walk, we can just calculate according to that. We can just calculate your exercise tolerance, and during this period how your deconditioning, physical deconditioning developing. Sometimes some people who starts walking, their oxygen level can come down. So during this test we need to measure the oxygen level and other BP, pulse and everything. So this is a test done under supervision of a doctor. So you can go for that one if you are having these severe post-COVID symptoms. But if not, if you are not having severe post-COVID symptom, you can at home itself you can start walking on the level ground. So you just walk for 5 minutes, then slowly you upgrade in the intensity and duration of walking. Like you make it 10 minutes, you can make it 15, 20, like that, and slowly you can upgrade your exercise. Like from walking you can go for some kind of aerobic exercise, then you can start, finally you can go for stretching exercise, and you can go for climbing stairs, like that. Slowly a couple of weeks, like in every week you just grade your exercise and you can follow up that one. Stay safe, be confident, and take care of health. Thank you.